Maximum daily dietary sodium intake is option A 2300 mg per day, option B 3300 mg per day, option C 4000 mg per day, option D 5000 mg per day. The answer is option A 2300 mg per day. Which test provides the best means of standardizing measurement of prothrombin time to monitor oral anticoagulant therapy? Option A plasma thrombin time, option B INR, option C partial thromboplastin time, option D activated bleeding time. The answer is option B INR. The test that is most specific for myocardial damage is option A creatine kinase, option B troponin T, option C troponin I, option D myoglobin. The answer is option C troponin I. Troponin is a protein found in skeletal and cardiac muscles. Troponin I and troponin T are two isotopes of troponin found in cardiac muscle. Troponin T also found in skeletal muscle. Troponin I found only in myocardium. It is specific to myocardial damage than creatine kinase MB and myoglobin. TROP-I level elevated within 3 to 6 hours after myocardial damage and peak in 14 to 20 hours and return to normal in 5 to 7 days. Normal TROP-I level is less than 0.4 microgram per ml and TROP-T level is less than 0.1 microgram per ml. Creatine kinase present in heart muscle, skeletal muscle and brain tissue. Creatine kinase MB is found specifically in the heart muscle. Creatine kinase MB level rise in 3 to 6 hours after myocardial injury, peak after 12 to 18 hours, elevated up to 72 hours. Myoglobin is normally found in skeletal and cardiac muscle. It is released into bloodstream when ischemia, trauma and inflammation of muscle occur. Kidney remove myoglobin from the body. High level of myoglobin can damage kidney. Normal myoglobin level is 0 to 0.09 microgram per ml. Myoglobin level is the first marker of cardiac injury after acute myocardial infarction. Myoglobin level rise within 30 minutes to 4 hours. Peak within 7 hours, return to normal level by 24 hours. Myoglobin also rise after skeletal muscle injury, so that creatine kinase and TROP-I may be required to determine myocardial injury. Cardiac enzyme levels are monitored in the patients with chest pain for which reason? Option A. Serial measurement of enzyme levels reveals the extent of cardiac damage and helps monitor healing process. Option B. Cardiac enzymes help identify the area of myocardial damage. Option C. Decreasing enzyme level help to estimate the recurring time for the patient with myocardial damage. Option D. Cardiac enzymes result will reveal if the patient is truly having chest pain. The answer is option A. Serial measurement of enzyme levels reveals the extent of cardiac damage and helps monitor healing progress. A non-invasive method of evaluating blood flow is option A. Doppler ultrasonography, option B. venography, option C. angiography, option D. cardiac catheterization. The answer is option A. Doppler ultrasonography. Doppler ultrasonography evaluates blood flow in the major blood vessels of the arms, legs, abdomen and extracranial cerebrovascular system through use of high-frequency sound waves and handheld transducer. Which measures should be performed immediately following a CABG? Option A. Ambulation, 12-lead ECG and clear liquid diet. Option B. Vital signs, cardiac rhythm and pulse oximetry. Option C. Vital signs, cardiac rhythm and clear liquid diet. Option D. 12-lead ECG, vital signs and ambulation. The answer is option B. Vital signs, cardiac rhythm and pulse oximetry. Immediately following a CABG, the patient's vital signs should be obtained, his or her cardiac rhythm evaluated, and pulse oximetry reading obtained to assess oxygenation. What are the signs of hemodynamic compromise? Option A, hypotension, decreased cardiac output and shock. Option B, tachycardia, hypertension and increased urine output. Option C, shock, diaphoresis and increased cardiac output. Option D, bradycardia, hypertension and decreased urine output. The answer is option A, hypotension, decreased cardiac output and shock. Signs of hemodynamic compromise include hypotension, decreased cardiac output, and signs of shock. Most common direct cause of sudden death is option A, cardiomyopathy, option B, pulmonary hypertension, option C, heart failure, option D, coronary artery disease. The answer is option D, coronary artery disease. Coronary artery disease is the most direct cause of sudden death, and cardiomyopathy is the second common cause of sudden death. Clinical signs of left-sided heart failure include option A, dyspnea and bradycardia, option B, tachycardia and restlessness, option C, dyspnea and tachycardia, option D, restlessness and cough. The answer is option C, dyspnea and tachycardia. Clinical signs of left-sided heart failure include dyspnea, initially on exertion, paroxysmal nocturnal dyspnea, chain-stroke respiration, cough, orthopnea, tachycardia, fatigue and muscle weakness. Pre-hypertension is usually treated with option A, diuretics, option B, lifestyle modification, option C, beta-adrenergic blockades, option D, ACE inhibitors. The answer is option B, lifestyle modification. Pre-hypertension signals the need for teaching about lifestyle modifications and the prevention of developing hypertension. Lifestyle modification may include changes in diet, adoption of relaxation techniques, regular exercise, smoking cessation, limited intake of alcohol, and restriction of sodium and saturated fat intake.